Hotep, and welcome to Matters of Diversity with Dr. B. I hope everyone is having a phenomenal Good Friday. Thank you for being with us today. Today, we're going to be honoring World Autism Awareness Day. And it is actually today. And with that, we're going to be bringing in our guests. We have 3 guests today who are going to kind of share their wisdom and kind of help bring us up to speed on what we need to know. My first person I want to introduce is Dr. Terry Daley, who is the director of the UCF Center for Autism and Related Disabilities, one of 7 regional support centers here in Florida, funded by the state legislature. She is a psychologist with a specialization in developmental disabilities and a board-certified behavior analyst, and has been working in the field of autism for 30 years. The center currently provides consultative support for over 16,000 individuals with autism spectrum disorders and their families in the Central Florida area. So I'm really happy to have an opportunity to talk with her and to learn what she does and how we all can be supportive of those who are dealing with this spectrum disorder. And then we have Pablo Agusto, who is a senior at UCF, focusing in on hospitality. And then we have Sho, who has an associate degree from Valencia and is planning to major in accounting here at UCF. This is the 2nd semester as a night. And so we're excited to have all of them here with us today. And so Sho Harold, Pablo Agusto, and Dr. Terry Daley, how are you all doing today?
Doing well.
Good, sir. Doing good, sir.
Phenomenal, phenomenal. So let's talk a little bit about today, and maybe Dr. Daley and Sho and Pablo, you can kind of tell me what's your thoughts on this day being designated Autism Spectrum Disorder Day.
Could I start?
Sure.
Okay. I think what this day means about not only because, it's not only because it's Good Friday, by the way, but today with being Autism Awareness Day, I think today just really shows how much autistic people, not just around the country, but around the world, who have faced the same challenges or the same difficulties as we have.
Right.
Because everyone's different, everybody learns differently. Everybody learns to focus in a way that they feel more comfortable. And it's just, I feel that we just need to really just take a day and just be able to learn about what autism really is, and just being able to have a day like this, to focus on those people who have been suffering in the past from certain types of behavioral issues, should really come to understand that, nobody's out there to harm them. This is a day where we feel all included, and just being able to realize that we're all one, and we're all included, and we all live in the same world.
Excellent.
And that's how I feel about this day, just being us being together to realize that truth and just know how important it is.
Excellent. So Sho, let me ask you, when did you become aware that you were dealing with this in your own life?
I would have to say it was about when I was much younger. I can't really remember off the top of my head how old I was, but I didn't really understand autism at first, like what it meant. But then as I went along, it was more than just a disability. It was like a life-changing factor that could, in my personal experience, that could stay with me the rest of my life. But it's not real. But if you look at it, it's not really a disease. It's just only a part of the brain and how it functions. And it kind of, and it does have an effect on the thought process as well, because autism can shift the way we think and like the way we do our normal daily activities on a normal basis. And also just to be able to understand how important it is to have autism. I mean, many people are told if at first when they have autism, the first thing that comes to their mind is fear. And that's what, you know, I've had to deal with the first couple of years of my life when I found out that I was autistic. But then again, at the same time, I'm able to work like everybody else and just feel included, and being able to function at a normal daily level.
Excellent. Excellent. Thank you. Pablo, what's your take on Autism Awareness Day?
Well, I think my take on the autism awareness, similar to Show's perspective on it, is that it's more the day's more of like caring for people with autism, whether it's someone with a high level, low level, or whatever kind of level that they're in. It's more about caring because nowadays with the um, with the situations that have been happening the past year, and everything was like full of hate and negativity, which is pretty common. What we try to forget, I try to forget sometimes, because I never grew up with that negativity. I never grew up with everything that's going on. Like, I care for people, whether it's a Latino such as myself, an African American, an Asian American, every single one in the throughout the world, I respect them as one.
Okay.
And sometimes I would hear stories from that people with autism, that like the stories that like they get treated like children regardless of the ages that they're in, and regardless of whatever level that they have. And it sometimes it gets really hard to try to understand the aspects of the difference between a high level and a low level, because one doesn't know how to understand this piece of the puzzle, even if it takes years to understand.
Right. So let me ask you, so you brought up the developmental part in terms of age and education. Is it more of an issue with regards to how you deal with and learn, or is it something that actually kind of takes over in terms of how you as a person behave and how you kind of move forward in the world? What's your take on what it means to be autistic?
My take on it is it's more like be careful about how you judge people. Like it could be something that we may not handle. It could be something that we're not comfortable with handling. Like it could be many other things that we're not comfortable with, which is a little understandable in a sense. With
Mhm.
and it would kind of like it would be like this question that I would sometimes have in my head, and I think it's common for all of us, that like, do they not trust me, or do they not have earned my trust, since they think I'm gonna go, you know, like cuckoo in the head or whatever, which I never do. Which I never do. I get shocked, but I don't necessarily get crazy.
Okay, that makes a lot of sense. And thank you for sharing that. And so, Dr. Daley, can you talk a little bit about your take on Autism Awareness Day?
Yeah, so I think that, the numbers of cases of autism that are being identified now are much greater than in the past. And that's in part due to things like World Autism Awareness Day.
Mm-hmm.
And there's a movement among the people who have autism that awareness is great, but acceptance is what we really need.
Okay.
And some of the things that Show and Pablo have shared about their, the way that they were afraid of how this would affect their lives, or how people judge them for behaviors, unusual behaviors or unexpected behaviors sometimes, goes to that whole idea of it's an individual difference that's brain-based, And there's some things that can be controlled and changed, and there's some things that we just need to accept.
Okay.
So this is kind of part of what the World Autism Days are about, to try to show that people are very different. When you've met one person who has this kind of a spectrum disorder, you've met one person and they're very different.
Very different. Can you talk a little bit about that, the continuum that's there, what the extremes are?
Sure. So on one hand, you can have, so autism affects three main things. It affects your social communication ability.
Okay.
It affects your interest and attention. And then it also affects your sensory thresholds. So some people on the spectrum are extremely hypersensitive to noise or textures or smells even. And others are very under responsive to stimuli. So they're constantly like, they want to rock or they want to spin, or they're constantly in movement or seeking vestibular stimulation. So that's one aspect of it. But if you think of it like three threads, it's kind of like a plaid. You know, you could have more red or more green or more white, and it's still going to be a plaid. You'll still say it's like autism, but you know, have very different looks to it. So we may have an individual who's completely nonverbal,
Yeah.
who like to communicate, who'd prefer to be on their own and is very hypersensitive, all the way to a person who is very super intelligent, but they just have a problem having those back and forth communications and understanding why people do what they do. They want to be with people and make friendships and have relationships,
Right.
but they just have these kind of barriers that they have to adapt to fit into the world that everybody has created.
Right. So is there a average age when people detect whether someone is dealing with autism?
Yeah, unfortunately, the average age is about 4 that people are identified, and it could be much lower. We know you can identify autism basically in the first year of life if you know what you're looking for, the red flags that you're looking for. We also know that students who are African American and who are Hispanic are diagnosed later than those who are not. So there's that tendency to overlook certain characteristics or things in certain cultures that are accepted and not in other cultures that may cause them to be identified later, which then leaves less time for that early intervention to take effect. So we want to see them diagnosed at 1 or 2, but 4 is about where we're at right now.
Can you speak to what those symptoms are or what people should be on the lookout for?
Sure. In very young children, it's things like when a child sees a bird or a light and they'll point up and they'll say, and they'll look back to you to see, do you see this? That kind of joint attention doesn't develop naturally for children with autism. They may differentially respond, like if somebody calls their name, they may not look up, but then when somebody opens a bag of Cheetos in another room, they're right there. They oftentimes have a hard time making eye contact and have some language delays or lose language. So those are some of the big red flags.
Okay. So so there is a continuum. There are people who you said have the extreme behaviorisms and things along those lines. Some of the milder things, utterances or things along those lines can be seen as almost normal behavior, but can kind of lead somebody to believe that someone has some autistic behavior problems or issues.
Right. So we have about 150 students on campus and then some also employees who are on the autism spectrum. And so some of the things that you might see in a person in that kind of a setting, a university setting, might be not taking a hint or answering rhetorical questions. Professors will propose a rhetorical question and the person will start answering it, or getting really interested in a certain topic or sharing their area of expertise in class to the point where it's taking up a little too much time. Those types of things that you'd see.
So Sho, can you talk a little bit about what your daily experiences are like and what you do to kind of maintain the things that you need to have happen on a day-to-day basis?
Sure. Well, usually on a typical work day, like Monday, well, usually my work days now are Monday, Wednesdays, and Fridays. And what I do during that time, I work 3 hours each day for those 3 days for now. And what I do is that I'm given a certain number of tasks by both my supervisor, Judy, and Dr. Daley. And what they provide for me is like, usually like, since I'm an accounting major, I believe that data entry is one of the most important factors in accounting, because that shows like how much information you're attributing to the company, as well as adding to their needs, because every week and every month new entries are coming in. And just today I've learned, well, actually, Judy showed me the way how to, like, but I was working on this Excel spreadsheet, and I was formatting all the cells and all the rows and columns. And since I haven't worked on Excel in a very long time, that was kind of like one of my biggest struggles.
Okay.
Was for me to not really understand fully about how to work an Excel spreadsheet. But as time went on, and as Judy and Dr. Daley taught me more about it, I started to kind of understand. And sure enough, I mean, we got to a good stopping point today where I was able to add up all the totals, and like added all the borders in the columns where the information was. And then at the top row, I just highlighted and just clicked on filtered, and then added a certain color on that row to label like which goes where, to make it look more professional. Because in an office setting, I learned that mostly everything has to be professional. And I mean, I try to be as detail oriented as possible, but I mean, that's what I do when I normally come into the office. And on some other days, like, well, usually Friday is when I usually head to the post office, and there's a lot of checks and mail that I have to look into to know that I'm caught up in everything. And just being able to have a job where, as an autistic child, that I'm still learning, and that I'm intelligent, but there's times that, I mean, I struggle and I do need assistance.
Okay.
Because in an office setting, you know, there tends to be a lot of talking and noises from time to time, which can be a little bit difficult for me to process. Mm-hmm. So that's why I always leave the door closed whenever there's like distractions, because I mean, a lot of that tends to happen within the workplace. And I've actually been doing better at focusing even with noise lately, even if it just happens to be for a little bit. But yes, I'm really just trying to be able to make it through life by working in an office. And it's probably a great feeling to be back in, especially after working remotely for over a year.
Yes. So let's give a shout out to Judy. Who is Judy, and how is she in your life?
Her name is Judy Samuel. She is one of my supervisors. Okay. And she's been doing such an amazing job, just not just helping me, but for everybody here. Like now she works from home, but every day she's just constantly working and just being able to make sure that everyone's caught up, and just getting everybody to succeed in the workplace, whether it be if they're continuing on here, they're in their future jobs. And she is so amazing to work with. I mean, she can be a little tough and strict at times, but overall, I think she's really acting that way just because she wants us to succeed in this world. And
excellent. Well, we have to thank her for being tough.
Of course.
So Pablo, Judy, Dr. Daley, you were going to say something.
Yeah, I was just going to say, Judy is our program manager, and she sets up a lot of our activities for adults and for the families and so on. And Sho is helping with managing trying to figure out how the budget works for everything. So he's learning about something for his field at the same time he's helping with our stuff.
Excellent, excellent, excellent. So Pablo, what's your day like?
Well, my day nowadays, I'm in the program called the Inclusive Education Services, which in short is IES. because we kind of made it that way. And then, well, usually like it's a 2-year program. We go by our 2 years with like how to learn in whatever major that we're in. So like we could do education, social working, and hospitality, which is one of those I am. And we go by our days with like classes on like learning mostly about hospitality, and we learn about like what our day could be at the office, or like what our day could be at a job which we're trying to pursue.
Right.
And then one of those months or years, depending on the semester, we our the staff would go around to find jobs that would be suitable for the students in the program. And we like sorry.
It's okay.
No, like and then we would have discussions with one of our staffs, and who are also our teachers, to say like okay, we got this job for you, and we want to know if you want to accept it. And then most of us, we said yes.
Okay. So let me ask you, what led you to hospitality?
Well, what led me to hospitality is basically only the entertainment side of hospitality. You know, uh, I'm not necessarily a crazy fan of Disney, but I love it, and also Universal. So um, that's what kind of drew me into it. I love entertainment. I grew up with movies. I even wrote a few screenplays myself,
Excellent.
just only for fun, and as a hobby.
Mm-hmm.
But I I still got much to learn when it comes to entertainment. Because entertainment, it's like a lottery of sorts.
Right. So what was one of the movies about, at least? Screenplays, I should say.
Okay, so this screenplay I did, and I one of the screenplays I did, and I don't know if I'm gonna seek to do a movie about it. It was about like a guy who just went out of rehab for you know whatever reason, and he's trying to like readjust he's trying to readjust his life, trying to like make those amends with with the wrongs that he's done. And basically you know basically I took this inspiration like a running jog. Like I see people running, and I was also inspired by this movie called The Way Back, with Ben Affleck, was a who was an actor struggling with alcoholism. and
Okay.
I felt like, okay, I felt like that was an inspiration for me to like put on a theme of redemption, because I feel like I'm kind of like a semi advocate of redemption, because like people can believe certain things, but like at the same time it's more of like we don't know what they've gone through, mostly, regardless of you know like the behaviors or the life that they grew up in. And I felt like that's a bit inspirational and more therapeutic in a sense.
Excellent, excellent, excellent. So, Dr. Daley, when you look at a person who's autistic, are there other times when they might have other disabilities attached to that? So, like, have there been times when someone who's been autistic and maybe a dyslexia or some type of other learning disability?
Yeah, it doesn't rule out any other kind of challenges. Many of the people who have autism also have attention deficit issues
Okay.
because of those focus and attention. Sometimes they get really focused in on one thing or a specific detail and can't pay attention to what's going on around them.
Mm-hmm.
Sometimes can't see the forest for the trees. We do see higher rates, especially with our adults, of depression and anxiety. And I
Okay.
think a lot of that has to do with trying to figure out how they can fit in and meet the demands of what society expects from them
Right.
with still being true to who they are. So we see some of that with our adults, where they have multiple challenges.
are there frustrations, or how does that kind of play out in some regards with individuals who are trying to maybe show or at least put into the atmosphere, so to speak, where they're saying what they're doing? I mean, what do those frustrations often look like? How do they manifest?
Well, you can see sometimes what we call a meltdown, where somebody's just pushed past the brink of what they can tolerate, and they
Okay.
may get very dysregulated emotionally, and have a large reaction to a small problem, or
Okay.
just shut down and put their head down or something like that. And a lot of times it's the buildup of emotions don't always get processed the way that they would in other people, where you can feel the gradations of getting angry, angry, angry. It's kind of like, I was calm and now I'm really angry. So how do you get that control back over you? So I think that's a big struggle, keeping control of your emotions. And then sometimes just wanting, one of the things that always came to my mind was a professor at Rutgers who said that he was working with a group of adults on the spectrum, and he was telling them, well, you have to do this, well, you have to adjust to that, well, this is what people expect. And the person turned around to him and said, well, if you guys are also neurotypical, why don't you adjust for a while? So it's that feeling of constantly having to change who you are to fit into what society wants you to be, instead of, you know, being understood that this is something that you're working really hard on just to do a great job. And I think, show spoke to that a little bit about, it's constantly learning and constantly adjusting to a new place, a new office, or things like that. And you can see that they have a lot of, a lot of detail and a lot of focus and a lot of talents that a lot of times are not seen, because people focus on, oh, well, he doesn't do this right, or he couldn't do that right, or he talks too much.
Yeah.
So there might be a lot of, we have a great workforce. We have, in our center, we have over 16,000 people that we're supporting around Central Florida, and they're growing up and they're going to need jobs, and they're going to have talents that will fit into work roles all around, around Central Florida. So we want to see them look at the strengths, not the weaknesses. We can always continue to work on the weaknesses, but there are a lot of strengths that these gentlemen have as well.
So what is the best way when you're dealing with a person with autism to kind of I guess navigate or communicate with them and to show them that you are there to support them and not there to hurt them or harm them?
Mm-hmm. I think, and maybe I'll hear from the guys too, I think letting them know truthfully what you're thinking, because it's a hard thing for people with autism to understand what other people are thinking or how they're reacting to your behavior. They may not perceive facial expressions or hints, like I said, hints or indirect kind of feedback. So being very direct with your feedback and telling them what you would like to see them do, or what you would expect, that can help them a great deal. They appreciate honesty. They appreciate predictability. That's another thing. Having a predictable schedule, knowing what to expect, can really help them. It decreases the anxiety and gives them something to kind of be planning for or toward, and that can help a lot.
Okay, great. How about you? How about you two? What do you think in terms of how people address you and meet you? What do you prefer? Start with Pablo.
Well, yeah, I just do an introduction of, people that are new to me and people that, I could possibly be good friends with or good colleagues. And, there are times when I meet this person, like I question myself sometimes, should I say that I have autism or not? And that was a scary part. And that's what's been stuck with me for the past year.
Okay.
Well, past years actually. I never wanted to express that I have autism. Like,
Right.
I never wanted to know about autism. I didn't want to learn more about it. I didn't want to dive into it. I really, really, really didn't want to express it, because it wasn't because I was denying it. It was because, I was scared of how people would react and how they would plan things ahead,
Okay.
of how they would treat me.
Okay.
which can be conflicting and challenging at times.
Okay. Thanks. Sho, what about you?
I would say the same thing that Pablo mentioned. Just, it just really depends on where the time and the place. Like, I, I sometimes when I'm with a group of friends or just, or if I'm interacting with any like certain like organizations or clubs on campus, like I just introduce myself, like what my name is, what my major, what my hobbies are, and that's pretty much it. But if I do get like in a classroom, like if the professor, like on the first day of class, for example,
Okay.
like if he or she decides to say like what's one fun fact about yourself, like I mean I would mention it, but I don't mention the fact that I have like autism, because like not many people would, I don't know how other people would take it, and just like me and everybody, like I said, everybody learns differently. So I try not to mention the fact that I have autism, even though I do,
Okay.
because it's like a learning disability. It's like a learning disability, and sometimes it could be taken the wrong way, and I sometimes have a fear over that as well. But I just, but once in a while, I wouldn't mind mentioning it, because there are some who actually try to say, oh, okay, well, let us know if there's anything we can help you with.
Yeah.
And because nowadays, especially college students, I think they're willing to help others who are like in need, and not be so prejudiced or judgmental.
Right.
Because the world doesn't need to be judged. And it's just every time I hear about all these like hate speeches and like people being just so prejudiced, it just makes me sick to my stomach just by thinking about it, because that's not what we're about.
Right.
We got to be able to be open and be able to listen to people and see what their needs are,
Excellent.
rather than just to degrade them, and just having to make such a big deal out of it, when really that's not the case.
Right. Right.
Can I ask a question? I wanted to ask the two of you, have you been bullied or ever felt like people have stereotyped about autism with you?
Yes, I have once when I was in middle school. I actually went to a private school for middle school. So, I was kind of picked a lot, like people would just kind of make fun of me, and just mimicking me about my personality, and
Okay. How about you,
trying to,
Pablo?
sorry.
No, you're good. You're good. It happens. Well, I can't remember a time where I was picked on, or hearing these kinds of stereotypes. Basically, I I don't remember if things would happen to me. Like, sometimes I would get the feeling that people would talk behind my back, and you know, there will be times where, like, like if they want to talk behind my back, I don't really care. I let them say what they want to say, like to make assumptions. Like, I don't care. Like, they go their way and I go my way, because one doesn't know the full story.
Right.
And we have to be careful with who we judge, in a sense.
So what made the two of you decide upon UCF? What was it about UCF that drew you to this as a place to get your education?
Can I start?
Sure.
All right. Well, the reason what made me choose UCF was not only because of the college setting and the campus setting, but like, how inclusive and then and then just so diverse that this campus is, and knowing that this community really does have a heart to, be kind to one another. And I feel like if I get involved in a certain club or activity, like, I mean, that would kind of help me to feel more included, just to show, I mean, not only how much I care about the campus, but really or not only myself, but others as well, to show that, I mean, we do need to make friends, and that, that we're all loved, and we're all appreciated regardless of our differences. Because, I mean, I don't want to go back to the time where I was in middle school, like 15 years, it was about 15 years ago, I would say, or even more than that, being at the same position that I am in today. No, that's not how it worked for me.
Okay.
Like, I mean, there's a lot of clubs on campus that encourage people to get involved in, instead of just staying at home, just having this feeling of self-isolation. And I understand what that feeling was, especially during most of last year, when most people had to stay home because of the pandemic. But I think for me personally, if I just continued on with that, like, I would never just get to experience life in general. And just, I think for me, being out in the community is what people really should be focusing on nowadays, especially because, I mean, for college students, they're only on campus for a short period of time. Like, they just come and go.
Right.
So, I mean, you never know who you may run into. You just gotta hang out with the right people at the right time. Don't let anybody pressure you, like, or say that, oh, you're not good enough to join because you have a disability and stuff.
Right.
Such. Because, I mean, that's just them, let them live their life and we live ours. It's that simple.
That's simple. Thank you. Thank you, Sho. Pablo, how about you? What made you want to come to UCF?
Well, what kind of made me come to UCF was one of the programs called the IES, which I mentioned earlier. And I've been hearing about this program through a colleague in UCF Card, and we had like a discussion about it, like what it is and what they do, and what classes they could offer you to do. And it took me some thinking and some interest as to like should I want this, because I've been talking to my family about attending college, and it's something that I've been wanting to do. Like what's that, what's the experience look like, what does, like, how does it work?
Mm-hmm.
And it was like a whole lot of steps to take to apply. I had to do a video. It took like, I think, 3 takes in a while. It was through the help of my high school teacher, who I look up to as my second mom.
Okay.
And it was as a speech teacher who was kind of help with them, with how I need to speak and how I need to answer the questions, understand as much as I could. And then through on a while, like, I think for the past, I think it was 1 month or so, I in February I was kind of accepted, but not necessarily accepted. I was more of like one of the candidates.
Mm-hmm.
And then we had to do like an interview day where, like, talk about ourselves and like basically anything that what the curiosity leads to them.
Right. So was that a hospitality thing? Was that because of the hospitality major?
Well, it wasn't necessarily that. No. No, it was more of like how do we behave? How do we,
So
How do we adapt?
it was attached to your autism.
Like meaning,
I think what he's saying is IES as a support around the campus for students who are traditionally not able to go to college because of their challenges. So there are several different tracks they pursue within their experience at UCF, and hospitality is one of those. I think there's childcare and one other one. I can't remember what it is. Right?
So
I think it
programs
was-
that are accommodating.
Yeah, so that's an interview process because it's a very small program. So they
Right.
can't let in a lot of people. So they do this very big interview process. It's prestigious to get in.
Excellent. Well, thanks. So talk a little bit about what you do, Dr. Daley, and how you are an influence for these students on our campus.
So we serve everybody from the time they're diagnosed right until they retire. So we have a very large base, and our center provides consultation. So we don't do the direct therapy, like speech therapy, like what maybe Pablo was talking about, but we help the families and the individuals by providing them with opportunities to learn about everything from potty training when they're little, because a lot of times they have issues with sensory issues with the potty training, all the way through how to make good eye contact, how to do an interview for work, how to respond, how to, what do you do if you're interested in dating somebody? All of those kinds of things are things that other people might learn by just, hanging out and watching, but a lot of times people with autism need more support to develop those skills. So we work with them and their families to help them to work on the skills that are important to them through that model. And we also do professional education. We talk to faculty, we talk to staff, we talk to employers about what is ASD and how it might affect people and what the benefits are of having students in the classroom or at work who are on the spectrum. They're very good workers. They don't go off and, chat around the water cooler and things like that instead of doing their work. And then we do public education and try to let people know what are the signs and symptoms so that families and young children can get early intervention to develop those good communication skills and social skills.
Excellent, excellent. I appreciate you sharing that. So when you think about how the university community can be more supportive of these students, what are some of the things that you would want us to know, like administrators and faculty, staff who are not on a day-to-day basis working with these students?
Right. So we are here, the UCF Center for Autism and Related Disabilities is over in the research park. So we're a little bit off campus, but a lot of people don't know we're here. And when they hear UCF card, they think of the ID office and they don't know what we're talking about.
Okay.
So to know that we're here and we are a support both as faculty and staff who might have children on the spectrum. We have some staff members who come to us and say, I think I might be on the spectrum. How do I go get an evaluation? So we can give them those resources. And then for students, we provide for the students if they want a letter of introduction to the professors, because even though they may have support from accessibility services, that doesn't tell anybody about what that condition is that they need that support for. And so sometimes just knowing, oh, I have a tendency to answer every question and not realize other people don't have a chance to answer, or things like that help the faculty to understand better or how to support a student in their
how they can intercede on their behalf.
Correct. Yeah.
Excellent. So what other things are coming up for you two gentlemen, Sho and Pablo? What are some things you want us to know about you?
Like what? Because
Just like outside of all this, what are your likes? What do you do? What are your hobbies? What do you have fun doing?
Oh, well, it's easy. For me, outside of UCF, I do play basketball. I've actually played for an organization called Special Olympics, which I don't know if you're familiar with or not, but it's an organization where they serve people who are on the spectrum like me, and they have all these cool activities like basketball, volleyball, track and field, and I've actually participated in not just basketball, but also volleyball as well. And I've actually won I think it's 3 state championships with basketball, and that just, and yeah, it just shows.
What's your favorite shot to take?
I would say the half court shot. And actually, I've been practicing lately. I've been actually practicing it backwards.
Uh-oh.
And it's
Good.
well, actually, even further than that. I mean, I do try to, show the world what my skills are, and just being able to encourage them that, anything is possible if you can set your mind to it.
Excellent, excellent. And that's the beauty of it all, is that anything is possible. You put your mind to it. Okay, excellent. Pablo, what about you? What are you doing for fun?
Well, me, basically, aside from screenwriting, which is kind of a learning process, I also I do acting. It's kind of like the one relationship I can't break up with. I mean, hey, acting is acting. I just love it. And, basically, I could be comedic at times. Like, when I do something unexpectedly funny or anything, we just, whether it's with my friends or my family, we just laugh our butts off. And, we just make the best one we can. And much of a I'm much of a socializer, and I speak Spanish fluently, but when it comes to like the difficult words in Spanish, I would have my mother or anyone in my family that speaks Spanish more than me to translate for me, just in case I don't mess up, which I'm a bit grateful for.
Excellent, excellent, excellent. So who are your support systems? Who support you all? You just spoke about your mom.
Yes, my mom, she's been my rock for, sorry, try not to cry.
Well, thank you, Mom. And
no, thank you, Mom. No, she's
caregivers.
she's been my rock for 20 years. I couldn't be more grateful.
Right.
There'd be times where like we would have our ups and downs, but we just learn from it.
That's okay.
She's a really strong advocate. Both Sho and Pablo's moms have done so much.
Beautiful.
To get them to where they are, and dealing with trying to get the best possible services, the best possible schooling, and they've been very successful. They should be very proud of these guys.
And I'm very proud of you guys. I really am. I'm proud that you will come here and be here. And there's nothing wrong with being proud of your mom. You're showing your mom right now how much love you have for her. And I think that is a beautiful thing.
Thank you, sir.
That's phenomenal. Thank you, Pablo. Thank you for being so vulnerable and sharing. Really, truly appreciate that. Pablo, Sho, how are you?
I'm feeling better now that I'm talking about it, because, if we're all alone, then we really don't have anybody to talk to, but that's why we're together. And whenever we're in this together, everybody's here for a reason. And, even though we may struggle at times, but, we just have to keep pushing through the tough times. And just like what my supervisor, Judy, and Dr. Daley say to me each time that I'm in the office, if I make a mistake, I just I just can't hold on to it forever. I just got to move beyond it and just focus on the task at hand. Because, life's too short whenever we're stressed or focused on one of our failures, that, because just because we fail just because we can't complete one task in a certain time frame doesn't mean we should stress out about it and be stuck in that moment. There's other tasks at hand that have to be completed, and we can only focus on one thing at a time, but just not to get too stressed or worked up about it.
I appreciate the wisdom that's coming from you two, and I know that people who will view this can really get a sense of what you go through on a day-to-day basis and what your life is like, and why it's important for us to reach out and to be unafraid. Because I think a lot of times people are fearful to communicate with people who are different from them. But we have to open up the space. And you talked about inclusivity and being a part of the narrative. And today you just proven why it's so important for you to be here. And so I thank both of you for that. Dr. Daley, what do you do when you are not at work and want to have some fun and let your hair down, so to speak?
Good grief. I feel like I'm always at work, but with COVID, it's like work, when does that ever end? But
When does it end?
I like to read. I like to spend time outdoors gardening and doing things like that, keeping busy with making flowers grow, hopefully. So that's one of my hobbies.
Yeah. And it sounds like you plant a lot of seeds. Not
Yeah,
just
we
in the
do.
garden, but you
Plant
plant seeds even at work every day. You're doing and helping people to grow.
Yeah.
That's a beautiful thing as well.
Yeah. And thank you for inviting us to do this. It's a great opportunity for people to learn more about autism disorders and to see real people and hear their story and their life.
Hear their stories. Yeah. Any last minute things that you want to share, gentlemen? Anything coming up for you? Pablo, how are you doing right now?
Well, aside from the tears rolling down my eyes, I'm just feeling better right now.
That's great.
He's going to graduate in May.
Wow. Excellent. You ready to go across that stage?
Yes, sir.
What are you looking forward to after post-graduation?
Well, basically, what I'm looking forward to is, I got to focus what I need to do. Like, I got to do a driver's license test,
Okay.
which is, hard at times. So I'm looking to do that. And then, depending on how successful I am, I gotta search for a job. Whether it's Disney, Universal, or anything that could help me provide to reach my goals. Then even if it takes years.
What's your major goal?
What's my goal?
What's your major goal? Yes. What's the thing that you want the most right now?
Basically, I want to try to reach for the stars. Like acting, directing. Even if I have to, work my way up to that level, even if it takes me 10 years or whatever, I'll just, I do it with everything that I have and I learn.
Pablo Agusto. They got the name for it. So I know that you can make it happen. And I'm here, I'm rooting for you. I'm behind you 100%. I want you to hit that mark and do the things that you want to do in the world. And so I'm excited. I'm going to be looking for those screenplays and those acting opportunities that you're in. How's that?
Hey, yeah, if you need an autograph, don't hesitate to come reach to me.
Look, I know now that we're buds. And so you have to. You can't deny me an autograph. You can't deny me.
No, I will never in 1,000 years deny someone, whether it's my family, my friends, or my fans, an autograph. Not in 1,000 years. I will just sign in an instant.
Phenomenal. Actually, then you'll have to send me one over already. I want a pre-autograph.
Yes, sir.
And what about you, Sho? What's the future hold for you?
Well, I'm kind of uncertain at this point. I may take classes. I may continue to search for another degree, but adding to what Pablo said about prior to me working in this job was that I actually used to work for Universal, both as a sushi chef for 3 years and as a busser for 1 year. So that's a total of 4 years that I've worked for the company.
Right.
And I mean, yes, it was a mentally challenging job at first, but I was able to persevere. And I mean, you know, how late they were open, especially on the weekends with all the people coming from different states and different countries around the world. Even right now, it's still spring break. I have a feeling the parks are still jam-packed at this time, but because of all the COVID restrictions, like I would assume that either they've reduced the hours, the operating hours over there to kind of keep in order with social distancing. But I have a feeling it's probably gonna, now that we have the vaccine and everything, everything's gonna be operating back to normal.
Yes.
I would say by end of summer or most likely beginning of fall.
Right.
But yeah, I don't work for Universal anymore, but back when I did, was, I mean,
So I think you're going in a different direction than.
sorry.
What do you want to do after you're done? What's next for you in your future?
I would say for me, I would either say continue working for PALS or just being able to take more classes just to kind of get my knowledge in line with me just to like get my knowledge in accounting, have like a more in-depth understanding.
Good.
Sorry, I kind of went back. Sorry that I backtracked, but I just want
That's
to
okay.
know that
Listen, this is your day. I am not going to begrudge you anything that you want to share with us. And
okay.
I thank you. I thank you both. I'm very proud to know you and to have had opportunity to talk with you today. I
Yes.
really appreciate you coming in and,
Sure.
and taking time out of your day to do this. I know that it could be daunting, and I'm wishing you nothing but success. Nothing but success moving forward. And if there's anything that I can do or my office can do to support you all, please do not hesitate to get in touch with us. And Dr. Daley, thank you for the work that you're doing. I can't imagine not wanting to have a greater love than to work for people. That's what I want to do. And you find your niche and you do that. So thank you for all that you're doing and what you're bringing to the university.
Thank you.
Thank you so much. And I want to thank you for watching us today. We're coming to the end of the hour, but please always applaud all that Pablo and Show are doing and what we can really learn and grow from when we kind of step outside of our comfort zone and deal with what the world is all about. It's dealing with people who are dealing with different things. We all are dealing with different things. These two gentlemen are dealing with autism, but that doesn't mean that they don't deserve our love and our respect and allowing them to shine. And so I really am looking forward to the progress that you all are going to make after you graduate from the university. And I can't wait to get my autograph. So thank you again for today. And to you all, we'll see you next time.
Thank you very much for having us, Dr. B. It was a pleasure to meet you, and we'll definitely keep in touch.
Definitely. Always.
Pleasure to meet you, Doc.
No worries. You all take care.
You too.
All right.
Have a happy Easter.
Side.